How long does a lip lift last? A lip lift is a surgical procedure with results that last for many years, unlike dermal fillers that wear off over a course of a few months. While most of my patients are happy with their lip lift, you do have the option to get a lip lift and follow up with lip fillers if that's the look that you prefer. Here's a guide. What is a lip lift procedure like? A lip lift is a surgery performed on the upper lip to rejuvenate it and provide a more youthful appearance to the mouth. The main objective is to create a more youthful, pouty appearance. As we age, the part of the lip between the nose and the cupid's bow becomes longer, and the red lip, or the part that we put lipstick on, becomes smaller, and there's less tooth show or appearance of the teeth when we talk and we smile. The lip lift brings back a bigger, brighter smile where you can clearly see your teeth the way that you did in high school. The most common type of lip lift is a bullhorn lip lift, or a modification of this. There are other types, although they're rarely performed. The bullhorn lip lift removes excess skin underneath the nostrils in the shape of a bullhorn. That's why it's named that. And it's used for those who have the longer area between the nose and the upper lip. After removing the skin is carefully sutured together. This technique creates a more pouty upper lip as the lip rolls outward and up and the teeth become more visible when smiling. For some people, a modified upper lip lift is preferred in that the incisions are actually hidden inside the nose, making it less visible. Either the bullhorn or a modification of the bullhorn can be used in conjunction with rhinoplasty since they share many of the same incisions. The gullwing lip lift is named after the seagull-shaped incision. This is done on the rim of the lip called the vermilion border and can be done on the upper and the lower lip to make them look larger. However, this can distort the appearance of the vermilion border and make it less visible. The corner lip lift is performed on those patients that have a downward turned mouth, making them appear sad or angry when they're not. For this procedure, triangle-shaped incisions are created in each corner of the mouth and the skin is removed. The edges are carefully sewn together, pulling the corners upward. This treatment also treats the little grooves that develop in the skin underneath the corners of the mouth that turn downward. However, these incisions can be visible and take longer to heal because of the constant movement of the lips. Is a lip lift painful? Prepping for surgery is always the best way to ensure an outcome of any surgical procedure. I advise my patients to quit smoking for at least 4 weeks before surgery and not resume for another 4 weeks after. Smoking decreases blood flow to the skin and can slow healing or cause complications. Alcohol is also discouraged for 24 to 48 hours prior to the procedure, as this can increase your risk of bruising and bleeding. Aspirin and other substances that thin the blood, such as fish oil supplements, need to be stopped for at least 2 weeks before the surgery. For each procedure, the incisions are hidden in and around the nose, making them less visible when completely healed. Normal activities may be resumed after 24 hours, but any exercise or strenuous activity will need to be postponed for at least 1 to 2 weeks. You can eat whatever food you feel up to, but avoid straws or foods that require opening your mouth really wide or moving the incisions for at least a week, as this pulls on the incisions. Sleeping on your back while elevating your head will help speed the resolution of the swelling. Use care brushing your teeth not to pull against the stitches. Many patients will use their finger or a child's toothbrush while brushing their teeth for that first week. After surgery, there may be some swelling around your nose or tightness when moving your lips for up to a month. Most patients do not report significant pain, but we do give you pain medication just in case. We also give you an antibiotic ointment to apply to the stitches and an antibiotic to take by mouth to prevent infections. The stitches will be removed between 5 and 7 days. The swelling or bruising that is noticeable to others should be resolved in at least a week. However, you may feel swollen and tight for about a month. Arnica is a great natural remedy for swelling and bruising. Does a lip lift change your smile? A lip lift does not change your smile. It simply restores your youthful look that you previously had. Many people notice that their smile has changed over time but don't know exactly how to describe it. Often this is because of a loss of tooth show and the long white lip in addition to the loss of volume. Since most people have heard of fillers and these are widely performed, many people try to address this by replacing the volume only. However, this doesn't fully address the changes and can lead to overfilling. By restoring your natural anatomy, your lips will look more natural and more youthful. Do lip lifts look natural? Lip lifts can look very natural. Any scarring is difficult to see when completely healed and is hidden in the creases of your nose. Your lips will move naturally and will look much more natural than the overfilling that you can see. No one will really know you've had surgery, but they may remark on how refreshed you look. How much does a lip lift cost? The average lip lift costs about $2,500 to $5,000, but can be less or more depending on which procedure is used, which region of the country is performed, and the surgeon doing the surgery. After consultation, I'll give you a clear idea of which procedure is best for you and we'll give you a definitive quote. Have questions? I'd sincerely love to help. Call or email anytime. Thanks for watching.